Are you curious about intermittent fasting? You've heard all kinds of information around it. Are you curious if it's safe or if it's effective? We're going to explore that, what it is, and then what are the pros and cons of intermittent fasting. I am Diane Thompson of kickbutthealthcoach.com for weekly tips on living a leaner, healthier life based on the newest science. Subscribe to this channel. Let's talk about some of the newest research in the area of intermittent fasting. Now, it's not been around that long, so some of the research is pretty spotty, but we're going to talk about the most common pros and the most common cons. We're going to describe what it is. So let's start there. Intermittent fasting is where you don't eat during specified periods of time. So you're fasting for as many as 23 hours during the day. So in that case, you would only be eating one meal. The rest of the day you go without food and you're drinking water. The shortest period of fasting that I've seen is 12 hours. So you eat for 12 hours, you eat meals in that 12-hour period, and then you fast for 12 hours, only having water. So, and now those windows can change. You can do a 12-hour, 16-hour, or a 20-hour window of fasting. So, I've even seen where you do something called a 5 to 2, so where you're doing 500 calories in a day. That's all, so that's not very much, and you do that twice in a week. So that's also considered intermittent fasting. And if you're a male, you would do 600 calories for 2 days that you pick in the week, and so you're only eating 600 or 500 calories if you're a female. So that's what it looks like. So what are some of the benefits? Well, there's quite a few. There can be quite a few. First one is, and this to me as a nutritionist and dietitian, not having to count calories, right? People really don't like counting calories, and then calorie information often isn't very accurate. So no calorie counting, so that relieves that problem. The other thing is that it improves insulin sensitivity. So imagine that. If you're someone who's borderline, diabetic, having an improved insulin sensitivity may reduce your risk for developing full-blown diabetes. Third thing is people have been known to have an improved blood pressure when they're using intermittent fasting, and decreased appetite. Okay, so as you're doing intermittent fasting, you may find you're less hungry. And one of the biggest benefits is that when you are not eating, what a lot of people don't realize is that digestion requires a lot of energy, and sometimes the body has to divert energy from healing and repair to digest the food that you're eating. So when you're reducing that and having bigger windows of time where you're not eating, your body can then use that energy to go heal and repair things that are going on in your body. The sixth thing is that you have reduced oxidative stress when you're doing intermittent fasting, and oxidative stress leads to inflammation, which inflammation is the root cause to most illnesses today, including Alzheimer's. So what they're also finding is that there can be a delayed onset of Alzheimer's. How good is that, right? So, but here's the thing, and this is where we get into the cons. There isn't a lot of research that suggests intermittent fasting is better as far as weight loss than other diet plans. Okay, so keep that in mind. It kind of depends on why you want to use intermittent fasting. If you want to use it as a weight loss program, you may be better off to do other things. But if you're wanting to use it for other reasons, you want to enhance healing because you're dealing with something, it might not be a bad idea. So you always want to err on the side of caution and check with your medical doctor, especially if you have health issues going on. So what are some of the problems? Well, in one of the studies that I was looking at, it's not a very sustainable diet, and you can see why that would be. If you're only eating one meal a day, that's going to be really hard to do, right? It's going to be super hard to do. So, and here's something else. 38% of people that were looked at in this one study had a really hard time sticking to that kind of a eating style. And much of the studies that have been done with intermittent fasting have been done on obese people, so we don't fully know the impact on people who are already at an ideal weight. So that's another consideration. And here's the big concern that many dietitians and nutritionists have around intermittent fasting is that you're teaching your body to ignore hunger cues. And hunger is not a bad thing. That's what we got to remember, right? Hunger is not a bad thing. It's saying, I need food, I'm hungry, as long as it's not emotional hunger, but we're not going to talk about that. So if you're teaching your body to ignore hunger cues, what happens is then when you do eat, you're so starved that it's really difficult to control how much you're eating. So another consideration, and it can lead to an unhealthy obsession with food. So be aware of all those things. So, and bottom line is, if you're wanting to lose weight, it hasn't really been shown that intermittent fasting contributes to greater weight loss than other weight loss programs. So you always want to go back to eating right and modifying your lifestyle, because for long-term results, those are the things that we know work, not a diet of any kind. So now if you're stuck, if you're struggling with your own weight, I have a weight loss scorecard that will help you identify what are those points that you're maybe missing in your lifestyle modification, so then you can go ahead and kickstart your weight loss and your health. So I'll put the information in the comments. So if you enjoyed this, please like it and be sure to subscribe for my weekly video on health and weight loss topics.